morning, everybody. My name is Agnieszka Olszanecka, and I would like to make the summary of the day 3 of the ESH Congress. It will be subjective opinion on what was the most interesting today. Well, the day started very early at 5 a.m. from the sunrise morning session at the seaside with a lecture given by Professor Jacek Wolf, the lecture in the beautiful surroundings on the coast of the Baltic Sea, focusing on the sleep quality and cardiometabolic risk. And what we know so far from the different studies is that shorter the sleep duration is, we have no doubt, higher cardiometabolic risk we have, higher calorie intake, higher BMI, and also these patients have the worse outcome. So the sleep hygiene is one of the most important or one of the important elements of the prevention of cardiovascular complication. Also, the shift work is influencing our cardiovascular risk, and the nap during the day is not balancing the sleep deprivation, and the influence of the shift work on our circadian profile and our biological clock is underestimated. In hypertensive patients, it's also important that the intake of antihypertensive medication may be influenced by the changed and not routine day of our patients. Then we had a very interesting session about the heart, hypertensive heart disease, and something beyond. The session of the Club 30 of Young Investigators of Polish Cardiac Society focused on the importance of multimodality diagnostics in patients with left ventricular hypertrophy. When we have patients with left ventricular hypertrophy, hypertensive patients in whom the extent of hypertrophy is not corresponding to the severity of hypertension, we should think about some other problems. Hypertension is common, but we should not forget that it can coexist with hypertrophic cardiomyopathy, amyloidosis, Fabry disease, or other. More and more importantly, we have a better understanding of this disease, and we also have treatment for amyloidosis, particular treatment for these patients. So diagnosis is very important. If we have problems in interpretation of hypertrophy in context of clinical history, physical examination, electrocardiogram, we should think about cardiac MRI, genetic testing, and dedicated therapy. Very beautiful lecture, I think very important today, was about obesity. The lecture by Professor Krzysztof Narkiewicz with the intriguing title, What Obesity Can Learn from Hypertension. First of all, obesity is the disease like hypertension, and we should raise awareness about the disease among our patients, but also among physicians. So like hypertension, it is the disease which is chronic, which is recurrent, and which needs the medication, not only non-pharmacological treatment, but also pharmacological treatment which influences the patient prognosis. We should not wait until obesity will develop its complication, and among this complication we have know that it's almost 200 of them. So treatment can change the prognosis in obese patient. Then we had the interesting joint session of the Polish Society of Hypertension and European Society of Hypertension, Dr. Ken I session, based on the frequently asked questions. Questions asked by our patients in everyday life, and these questions very often refer to everyday life activities, not about guidelines, not about the treatment, but about the physical activity, other medication, dietary supplements, coffee, and other interesting session, 5-minute slots and very short answer with take-home messages. We had also the session about the new trials hotline session too this afternoon. And among these trials, it's important to mention the meta-analysis of 46 trials addressing the problem of relative blood pressure reduction in patients with chronic kidney disease, with the conclusion that the benefit of blood pressure reduction in patients with chronic kidney disease is similar like in patients without chronic kidney disease. Important study was also published by Professor Schmieder Group about renal denervation in patients with polycystic kidney disease. The population, which was never studied earlier, and the results of the small study, but including 21 and 23 patients, shown that blood pressure reduction may be significant and both home and office and 24-hour ambulatory, which is important for the patients in whom hypertension develops early in life. Then we had a new study on zilebesiran, which is the emerging therapeutic agent for treatment of hypertension, based on the small interference RNA technology, which is silencing the mRNA for angiotensinogen in the liver. The first phases of clinical trials, phase 1 and 2, were very promising, the cardio trial, and now we are expecting the recruitment for the new study, the Zenith study, in which 11,000 patients are going to be recruited, and this is a study based on the outcome like cardiovascular death, hospitalization, heart failure, myocardial infarction. In 2 years, we should have the data about that. Thank you very much.